If you are planning on starting your birth control pills for your first time and you want to make sure that you are taking it properly, keep watching this video and you will learn all you need to know about the pill. But first, my name is Diana. I'm a physician assistant. I specialize in women's health and gynecology. You are watching In the Pink, and if you're new here, In the Pink means in good health and spirit. So if you like being healthy and happy, click subscribe because you're in the right place. So when it comes to the birth control pills, there are two main kinds: the combination oral contraceptive pill and the progesterone-only contraception pill. And for this video, we're going to talk about the combination oral contraception pills, or COCs. And when I say combination, it's because it's a combination of two hormones, progesterone and estrogen. Now, if you were to Google COCs, you would find a whole slew of different names of this type of birth control. And that's because there are many different combinations of the types of progesterone and the doses of both the progesterone and the estrogen. And there's more. Also, how often you take a pill with the actual hormone in it versus a sugar pill. And I'll talk about that in a bit. But when you mix that all up, you have a lot of variations, and it can seem a little confusing, but it's really not. And here's why. They all work pretty much the same way, and you take them pretty much the same way. So I'm going to talk about that first. So first off, the packets all look fairly similar. Some packets are round and some are rectangular. But if you have a 28-day packet, which is the most common birth control pack, you are going to see two different colors of pills. And that's because there are two different kinds of pills in your packet. There are the pills with the active hormone in them. Most of the pills are these ones, usually 21 or 24 of the pills. And then the rest of the pills in the pack are just sugar pills. There aren't any hormones in those. And usually when you are taking the sugar pills is the time that you are going to have your period. Now, hormonal birth control pills are the most common way to prevent pregnancy in the US. It's 99.7% effectively when taken perfectly. So just 3 out of 1,000 women will get pregnant on a given year if it's taken perfectly every single day. Now, if the pill isn't taken perfectly every single day, the chances of getting pregnant increase to 90 out of 1,000 women. So that's a pretty big difference. And so it's really important to know how to take a pill perfectly to decrease your chances of getting pregnant the best you can. So let's talk about how you take your pill perfectly. Like, what does that mean? So in order for your pill to work the most effectively, you need to take the pill every single day at the same time in order for your pill to work the most effectively. So I usually recommend my patients take the pill at the same time as something else that you do every single day without fail. For example, when you brush your teeth at night, or something else that you just know that you do every single day. That way, taking the pill will coincide with something else that you're already doing and already are in the habit of doing every day. Another idea is for you to set an alarm on your cell phone to remind you to take your pill every day at the same time. Also, keep in mind that there are certain antibiotics that can decrease the effectiveness of your birth control pill. These antibiotics aren't prescribed often, but if you ever are prescribed an antibiotic, make sure to check with your provider to make sure that that is not going to make your birth control ineffective. There are a few different options with how to actually start the pill once you get the packet home from your pharmacy. Now, you can do what we call a Sunday start. This means that you start your pill the first Sunday after the first day of your last period. So when you do this, it makes it so that your period is more likely to happen during the week, so you don't have to worry about your period on the weekend. You can also do what's called a quick start. So a quick start means that you start any day you want to, but you have to make sure that you aren't pregnant before doing this. And depending on when during your cycle you start the pill and the last time you have intercourse, you might have to use a backup for the first week. So let's talk about that. So if your first day of your last period was 7 days ago or less, so less than a week ago, go ahead and start the pill, but you should use a backup method for a week. If you've had a negative pregnancy test and the first day of your last period was more than 7 days ago, and the last episode of unprotected sex was more than 5 days ago, then if you want to start the pill, you can, but you need to use a backup method for 7 days. And then you should check a pregnancy test in 2 weeks just to make sure it's still negative. If you have a negative pregnancy test and the first day of your last period was more than 7 days ago, but your last episode of unprotected sex was 5 days ago or less, then you need to talk to your medical provider about emergency contraception, like today, like call them today. Now, if that seemed confusing, just go back and listen to it again, kind of figure out where you are, and then you can make the decision from there. But if you're still not sure, whoever prescribed your birth control pill will help walk you through it. Just give them a call. They'll help you figure it out. Now, there are a few reasons why you should not take the combination birth control pill, because the health risks are considered too high. And hopefully, whoever prescribed you your pills have already asked you these questions, but if not, and if you have one of these things I'm going to talk about, you shouldn't take the pill. Go back to your medical provider and discuss alternatives, because taking the combination pills aren't safe for you. So first off, if you're 35 and older and you smoke 15 cigarettes a day or more, also, if you have multiple risk factors for heart disease, if you have hypertension or high blood pressure, if you've had a blood clot, or if you have known heart disease. Also, if you've had a stroke, or if you've had heart valve disease, or if you've had breast cancer, diabetes, cirrhosis of the liver or liver cancer, or interestingly, if you have migraines with auras, you should not take a combination birth control pill. Call whoever prescribed the pill and talk to them about it to see if you need to start something else, because most likely they won't want you to take the pill either. Now, in the near future, I am going to be doing a video on what to do if you accidentally miss or skip a pill. When do you need to use backup? What do you do with the pill that you forgot to take? Stuff like that. So hit the notification bell so you'll be notified when that comes out. And of course, you should subscribe as well. Up next, when to know if your discharge means that you have an STI. Click on that if that interests you, and I will see you over there. Stem cells can help with autoimmune deficiencies, sickle cell disease, certain metabolic abnormalities. They can also help with certain cancers and some serious anemias like leukemia, and they can also help with spinal cord injuries and with Parkinson's. There are two types of transplants that you can use.